Now, let's talk about the third wave for a little bit. We can see that it has been four digits number for so many days, especially in the last 6 days. It's up to over 2,000. And these numbers is what triggering the growing fear in Thai people. And there have been warnings for some medical experts, to be exact, that Thailand is experiencing the third wave and the worst wave of COVID-19. So where they expect the double-digit death toll to become a regular daily occurrence. Professor Dr. Prasit Wattanapha, the Dean of Mahidol University Faculty of Medicine, Sirat Hospital, spoke up as the country recorded 15 COVID-related deaths. He said that the Sirat Hospital, about 1 in 4 COVID-19 patients, has developed lung inflammation. And with this rate, which is more than before, will translate into a high mortality rate. And perhaps we can expect to see a 2-digit figure every day. That sounds very alarming. Thailand's third wave of the COVID-19 pandemic, which began in early April, has already killed 84 from almost 33,000 infected. This means that COVID-19 has killed more people this month than a whole of 2020 in the first outbreak. Also, COVID-19 is no longer killing only elderly people or those with chronic diseases, as 2 people who were only in their 20s have recently died. Meanwhile, Dr. Chawetsan Namwat of the Disease Control Department said that the epidemiologists are trying to determine if the soaring death toll is also linked to people's difficulty in accessing medical services. At the same time, Dr. Prasit also noted patients' demand for ventilators and ICU care had risen sharply in recent weeks, and a scramble for the antiviral drug favipiravir has already begun as the demand is increasing across the world. He added that while Thailand is not yet suffering a shortage of ventilators, special respirators needed for severely ill COVID-19 patients were not readily available. However, the Director General of the Disease Control Department, Dr. Opat Kankawinpong, said that his department was closely monitoring the situation and might adjust treatment guidelines in a bid to save more lives.